In this video, we are going to discuss what you can expect if you have an injury in the C5 or C6 area. There will be a few differences between the two because there's a specific motion that people who have a C6 injury are able to do that someone with a C5 injury is not. C6 is the location that allows us to move our wrist up and down. Typically, they are still not able to have control of their finger muscles, but they are able to move their wrist up and down, which creates something called tenodesis, where from the natural ability of our wrist moving backwards, it creates a grip with our fingers at the top. So if I leave my hand relaxed and I bend my wrist back, then my fingers will naturally fall into a tighter grip. Someone with a C6 injury might be able to use that movement to help grip objects. The learning objectives are listed above. We're going to identify activities you may need assistance with and equipment that might be useful to you, as well as describe your level of function with a C5 or C6 injury. With a C5 injury, you will be able to raise your arms in the air, bend at the elbows, and shrug your shoulders. And like we already talked about with the C6 injury, you'll also be able to bend your wrists backward. You will likely have the ability to speak and breathe on your own, although breathing may be weak and your voice may be weak as well. With a C6 injury, you might also be able to chew. You will also be able to advocate for yourself and direct your own care, and will also be able to use a power or specialized manual wheelchair. Some things you may not be able to do is feel or move your trunk or lower body, and with that you might not have bowel or bladder control as well. With a C5 injury, you will need total assistance with bathing, toileting, grooming, and dressing, and a C6 injury, you might need some assistance with those things, but also, like we talked about with the functional grip from tenodesis, you might be able to manage more of those on your own. At both levels, you will need assistance with transfers and moving from place to place. With a C6 injury, you might be able to transfer using a slide board. Likely with the C5 injury, you'll still require the assistance of someone else or a caregiver with you. Another piece of equipment that might be used to help with transferring is a mechanical lift, or also called a Hoyer lift. As seen here, you slide the sling under the person being transferred, and it connects to this device, which can then help transport them. There's also several pieces of other equipment that can help with things in the day-to-day life. So pictured here in the blue is a universal cuff. You can hold a toothbrush, hairbrush, any kind of utensils inside of it as shown here, and then your hand will loop around the other side, like on the left, and it will help to keep a tighter grip on an object for people who don't have as much grip strength. This is what we call a plate guard. It attaches onto the outside edge of the plate so that when someone is scooping up food, they can use the edge of the plate to help load the food onto the spoon. And an example of an adapted cutting utensil is pictured here. You would put your hand up on the blue part and rock your wrist back and forth in this motion so that it cuts the food beneath it. Something that's extremely useful for toileting is what we call a 3-in-1 commode. So this can sit next to the bed for someone to use the bathroom on by using the bucket pictured here. It just slides under the hole, and then when that person's done using the bathroom, you can just dispose of what's ever in the bucket. Or this could be sitting on top of a regular toilet just to make the toilet taller. And there's also handles on the side to help support people who might not have as much core strength. You can also expect to be involved in multiple different kinds of therapy. With occupational therapy and physical therapy, some goals that you can expect to work on include strategies to ensure frequent and proper pressure relief and prevent skin breakdown. We'll be able to help you direct your own care and self-management of bowel and bladder schedules. We'll work on how to educate family and caregivers about how you would like to receive your care. We'll assist with your ability to use a power or manual wheelchair, and you'll work with us to help develop strategies to help you complete your activities of daily living with as much independence as possible. And that will wrap up what we believe you need to know and what you can expect when you have a C5 to C6 spinal cord injury.